Hello, everyone, and welcome to In Service of Health, where we bring leaders in healthcare and public health together to have really important conversations about what we need to do to advance health in the U.S. So a bit about me, I am a practicing emergency medicine physician. I'm a mom. I'm a former neurosurgery patient, which we can talk about, and I've worked in public health across federal, state, and local government. I've worked in corporate America, I've worked in nonprofits, I've worked in academia, and now I am so honored to be the president and CEO of the Public Health Accreditation Board, what we call PHAB. PHAB is the sole accrediting body for public health departments in the United States, and we set and hold the standards for what it means to advance strong public health systems and practice, and to do it with excellence. And we are starting this podcast in service of health because we believe as a collective society that we can think better, bolder, and quite frankly, more strategically about how we work together to improve health in America, importantly, working across sectors. So here's my story. Here's why we started this podcast. And here are some key questions we hope to answer as we embark on these conversations. So what is my story? So my parents hail from the east side of Detroit and moved to Ann Arbor, a college town in the suburbs west of Detroit, right after high school as teen parents to raise their family. And so, growing up, I was never without what I needed. Of course, I had food, I had clothing, I had shelter, there were good public schools, sports activities, a lot of love, even some family road trips here and there. But I'll tell you, I always knew a lot of struggle had happened in the lives of the people who came before me, the lives of my parents, my grandparents, etc. And, I had a sense that there were things in the neighborhood that my parents grew up in, things like high rates of smoking, chronic disease, substance use disorders, with an underlying theme of poverty, quite frankly, that were really things that were preventable, unnecessary, and quite frankly, fixable. And so I decided that I would fix it. And I would fix all the challenges I saw by becoming a doctor. And so fast forward, I went to medical school, and pretty quickly in medical school, I realized, like so many others do, that while I certainly liked seeing patients, I still practice emergency medicine and love it, there was only really so much I could do to advance the health of my community with individual patient interactions. And so I always wanted to do more. The turning point for me was my intern year. I graduated medical school. I chose to do emergency medicine. And my intern year of my emergency medicine residency training program in Brooklyn, I was pregnant. I was recently married. We were pregnant with our first child. I was healthy. The pregnancy was pretty easy, and I planned to have a natural childbirth. But things did not go as planned, as often happens with pregnancy and childbirth. I ended up in labor for over a day, and I needed a C-section. Afterwards, after my delivery, I was having severe headaches, and I remember complaining. I notified my clinical care team in the hospital right after birth, in my post-op visit with my obstetrician, in the first pediatrician visit even with my newborn son and my husband with me. And I was pretty much overlooked and dismissed until finally one day I called my own doctor friends at the hospital where I worked. Again, I was an intern. This was 3 weeks after delivery. And I told them about my symptoms. And of course, they knew me, right? They understood there was no reason why a young, healthy, strong woman who was a Brooklyn ER doc should be crawling on the floor crying with a headache. And so they got me the imaging that I needed, and I was diagnosed with bilateral subdural hematomas. Essentially, there was so much blood in my head that my brain was starting to be pushed down out of my skull, and my life was in imminent danger. And so there I was, 3 weeks postpartum. I had emergent surgery to open my skull on both sides and have the blood drained out of it. And so what did I learn from that? I learned that, healthcare needs to do a better job of listening to patients and not dismissing them. I learned that we need to do a better job of supporting families holistically, not just focusing on one part of the family during a visit, like a mom doubled over in pain so much that they can't even hold their newborn child. I learned that even a lot of things that doctors think are minor, like taking drains or staples out of someone's scalp, that actually hurts a lot. And we should be mindful of that and provide the right pain medication. I learned that healthcare needs to not just think about the immediate medical needs of a patient, but at least have an understanding of what the needs are inside of the home and what patients need once they leave the hospital. And I learned that healthcare, as we all know, is very, very expensive. I got a bill for both cuts on both sides of my head. And if you don't have good insurance, you could essentially go bankrupt pretty quickly or make a decision to forego care, which could be life-threatening. So of course, things worked out okay for me because I'm here today to tell my story. I'm grateful to be here today to do that. But this experience has really made me want to do better, to not just be a good doctor, but to really make better programs, better policies, and to help fix this very broken and non-patient-centered thing in America that we call a healthcare system. That's why we started this podcast. We want to have candid conversations, not just about the problems, but about the solutions and what we should be doing, particularly to address the silos across sectors that are expensive, inefficient, and ineffectively addressing the poor health outcomes that we are seeing across the board. What if hospitals and public health worked more closely together on strategies to improve things like vaccinations or to address chronic conditions? What if health plans and public health were more closely aligned regarding expectations for outcomes for population health? What should we be doing now with dwindling budgets and potentially millions slated to lose their health insurance in the upcoming months? What is working? That we need to actually scale more broadly. And what's not working? And what do we actually need to be doing less of? These are some of the things that we hope to uncover with the guests on our podcast In Service of Health. We will have candid conversations with leaders in healthcare and public health to reimagine what we could and should be doing and how we can work better together. Thanks for tuning in, and I hope you will join us on this journey.